Hello friends, today we are going to discuss about myths of attention deficit hyperactivity disorder. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at NIMANS, Bangalore. ADHD is a childhood disorder. This is a myth. The current scientific literature clearly indicates ADHD is a lifetime neurodevelopmental disorder. In fact, the prevalence of adult ADHD is 2 to 2.5%. That means even in adult, ADHD continues to exist and creates havoc in their life. ADHD usually manifests as a single disease or an entity. This is a myth. The rule of thumb in ADHD is comorbidity. That means 2/3 of the patients suffering from ADHD will have one or the other psychiatric or physical comorbidity. Hence, my dear friends, whenever you are doing an assessment for ADHD, please look for comorbidity. 70% of the time they will have one or the other psychiatric or physical comorbidity. Myth number 3. ADHD medications, especially the stimulants, causes addiction in patients. This is again a myth. The fact is, prospective studies have clearly indicated ADHD medications, especially stimulants, do not cause addiction in most of the patients. Only around 10 to 20% of the patients who are genetically vulnerable for dependence will develop addiction. Otherwise, majority of the patients do get benefit from ADHD medications. Myth number 4. Treatment with stimulant medication is risky and dangerous. Again, this is a myth. Stimulant medication and even non-stimulant medication in ADHD is not dangerous or not risky. In fact, medications are the first line of treatment in ADHD and they help the patients, especially children and adolescents, to get their life back on track. Hence, my dear friends, please do not hesitate prescribing ADHD medications to the patients who are suffering from attention deficit hyperactivity disorder. Myth number 5. ADHD medications are sedative, tranquilizer. They will cause sleepiness, sedation, and zombiness in children. Again, this is a myth. ADHD medications are usually stimulant and increases the level of neurohormones in their brain. That is, catecholamines increases in their brain. And in fact, they are found to be very helpful in children and adolescents for the treatment of ADHD. Myth number 6. ADHD medications are not useful for any purposes because the children are already hyperactive. By giving stimulant, it will worsen the symptoms. Again, this is a myth. Most of us, the doctors, believe ADHD means already the kid is hyperactive. Why do you want to give stimulants? This is a question which arises very often. In fact, these stimulants will stimulate prefrontal cortex, which is major function is inhibitory in nature. That means it inhibits various excitatory neurohormones such as glutamatergic, and it enhances GABAergic activity. In such a scenario, by increasing the catecholamines, it indirectly influences GABAergic activity and glutamatergic activity. Hence, stimulants have been found to be very useful in ADHD. Myth number 7. ADHD medication should be given only for short duration. No, ADHD medications have to be given for months to years because ADHD is a lifetime neurodevelopmental disorder. That means the child is growing, and even in the adolescent and in some few patients in adult, these ADHD medications are highly recommended. Myth number 8. ADHD medications are not required in adult. As I mentioned in the previous slide, this is also a myth. Even adult, approximately 2.5% of the population suffer from ADHD, and many of them may require stimulant or non-stimulant medication for addressing the issues of ADHD. Myth number 9. ADHD medications should not be given during holidays Or you may have to consider drug holidays whenever they are on a vacation. Of course, earlier this was the thought. Currently, the scientific literature, the evidences are accumulating to go against this drug holiday because ADHD continues to exist and you're not giving medication just for studies, not just for academics. These kids or adolescents require help even in social situation and also having good interpersonal relationship with family members, peers and relatives. Hence, they say you need to continue medication for longer duration of time and it is not just recommended only during school and stop it. That is not recommended. Myth number 10. ADHD gets cured after 18 years of age. That means children outgrow ADHD. This was the earlier literature. Now, the prospective studies have clearly said that 60 to 70% of children with ADHD continue to have symptoms and they will have symptoms even in their adulthood. That means they require medication for longer duration of time. And as I mentioned, again I am reporting here, 2 to 2.5% of the adult continues to have ADHD. That means they require medication even in the adulthood, and ADHD has been found to be diagnosable even in adult. And there are some literature reporting that ADHD sometimes can be seen in the adulthood for the first time. They may have not had ADHD in the childhood or in adolescence. It may appear suddenly in the adulthood. But however, these are all preliminary evidences, require systematic study. Myth number 11. ADHD medication should not be given in patients with substance use risk. Suppose there is a family history of alcohol or tobacco. We should not give ADHD medication. This was the earlier thought. Currently, the scientific literature clearly says even if there is a risk of substance use, stimulants are the first line of treatment for ADHD, and studies have indicated this does not increases the risk of substance use again. That means you need not worry about precipitating of substance dependence. Most of the time, ADHD medications are found to be very beneficial for these patients. Myth number 12. Stopping ADHD medication will cause relapse in all patients. The fact is, 30% of the patients do not get ADHD when the medications are stopped. But however, 70% of the patients will have relapse within a period of 1 to 2 months. In fact, the literature says within a period of 2 weeks, majority of them will relapse. But in rarer cases, the relapse may occur even after 2 months. Myth number 13. Medications are not required for treatment of adult ADHD. As I mentioned earlier, this is a myth. The fact is, medications are the first line of treatment in ADHD. Myth number 14. There is no really effective treatment for ADHD. Medications are oversold as a marketing ploy by the pharmaceutical industry. Of course, to some extent it is true, but the research evidence clearly indicates that medications are the first line of treatment in ADHD and especially stimulants. Of course, these pharmaceutical industries wants to sell their medicines aggressively, but the reasonable, prudent doctor should weigh the risk versus benefit, educate the patients and the family members, and with the collaborative efforts, only the medication should be started. That means, although some of the pharmaceutical companies are marketing these medications, maybe aggressively, maybe there is a ploy to increase their marketing strategy, but the doctor should be knowing about this. At the same time, the benefits of these medicines also should be told to the patient and their family members. And various guidelines, expert guidelines clearly says that medications are the first line of treatment in ADHD. Again, the myth number 15th. CBT should be given before giving medications. Again, this is a myth. The fact is, medications are usually started first. Once the symptoms are under control, cognitive behavioral therapy, or even coaching or mentoring can be started later. Please do not start CBT or various other therapies before giving medications. And various meta-analyses have clearly said that cognitive behavioral therapies should be started after the medications. Not only that, although you may give cognitive behavioral therapy, they may improve in the domain of social skills, they may improve on interpersonal relationship. ADHD continues to manifest and the functional impairment continues to be there. Hence, medication should be given. Later, the therapy should be added. Myth number 16. ADHD is caused by bad parenting. This is the biggest myth. Because the parents will be carrying this guilt that I have an ADHD child and because of me, the child is suffering. The fact is, ADHD is a neurodevelopmental disorder. The combination of genetics and environmental factors play a role in the development of ADHD. Myth number 17. Children with ADHD are intelligent and they become successful in life. This is a big myth. The fact is, ADHD destroys life. Most of the children gets dropped out from their school and few of them gets even dropped out from the high school or even in the college. They may not be able to hold on to job. Comorbidities such as substance use, depression, attempted suicide, gambling, early mortality is the fate. Only fraction of the patients who have ADHD and few of them who are intelligent are successful. And do not generalize this because many of them think that ADHD should not be treated. Once the ADHD becomes severe, and if you don't treat early, by the time the child comes to the high school, his peer relationship, his academics, his interest towards studies will be destroyed. The child will have irreversible social dysfunction, academic dysfunction, and they may start hating schools. That should not happen. Hence, my dear friends, ADHD should be diagnosed early and treated early. Myth number 18. Children with ADHD cannot focus or concentrate. Again, this is myth. There is a phenomenon called as hyperfocuses. In this hyperfocus, many of the ADHD children become highly interested in certain activities. It may be gaming, it may be playing certain activities. In such a scenario, they get completely absorbed in the task and they have this hyperfocus and they'll be able to finish the task. This hyperfocus can help in such activities, but however, in majority of the task, they will lose attention and concentration. Whenever these tasks are monotonous or else if they do not interest them, they lose concentration very fast. Hence, do not judge a child just because he is able to sit in front of TV for longer duration or in front of maybe computer. They may be having hyperfocus in this situation. Hence, thorough evaluation is required, assessment of the child in various domains such as at home, in the society, in the education center, maybe in the playground. You have to do a 360-degree assessment. Then only the diagnosis of ADHD has to be done. There are no investigation at this point of time to diagnose ADHD. ADHD should be diagnosed by clinical information or else by clinical assessment and adding with the structured assessment. And you need to collect information from the parents, teachers, relatives, friends, so that you have a information which you can use to diagnose the children. Hence, my dear friends, please remember, ADHD is a neurodevelopmental disorder. It is a lifelong disorder, requires medication, early diagnosis, and treatment is the only way to go forward. Thank you very much for your valuable time. Stay safe.